Fox 56 News Chief Medical Contributor Dr. Ryan Stanton is with us in studio.
This morning, he's focusing on how not enough people are getting a lung cancer screening.
Yeah, this was interesting because it was a topic that came up this weekend at the AMA interim meeting in Washington, D.C. I was there. So it's very interesting, and it's very apropos to talk about this with regards to Kentucky, because we're one of the largest states that need to make this happen. A new report from the American Cancer Society reveals that far too few eligible adults are getting screened for lung cancer, the nation's leading cause of cancer-related deaths. Published today in JAMA, the study shows that only 1 in 5 eligible Americans received a recommended low-dose CT scan in 2024. Researchers analyzed data from the National Health Interview Survey and found that more than 12.8 million adults met the U.S. Preventive Services Task Force criteria for annual screening, yet just 18.7% were up to date. This is important for all Americans, but especially in states with lower screening levels and higher smoking rates like West Virginia and Kentucky that have the top 2 smoking rates in the U.S. and disproportionately impacts rural and middle to lower income individuals. Lung cancer will be diagnosed in 225,000 Americans this year, and more than 125,000 will die from the disease. Screenings is recommended for adults aged 50 to 80 with a significant smoking history who currently smoke or quit within the past 15 years. Researchers estimate that universal screening could save more than 62,000 deaths over the next 5 years, underscoring the urgent need to increase awareness and access. So this is huge because in Kentucky, we're estimating in most of these states really that 10 to 20% of those candidates can get it. We know in states that have focused on it, I think Massachusetts is one of them, they have an 80% rate of screening. So this is huge if we make sure that those that are eligible get that screening done, which is a low-dose CT scan that is done to pick up masses or lesions very early.
When I was a kid, I was unfortunately around a lot of secondhand smoke, and then I got into my 20s. They still allowed smoking at bars, and so I was around a lot of secondhand smoke then as well. But I obviously haven't been around a lot of it in many, many years since then. In those instances, is the damage already done from many years ago, or is it
technically the risk has dropped off? The
Okay.
risk has dropped off. I mean, damage can be done, but the risk drops off, so it wouldn't be recommended for you. I mean, this is a risk benefit of a CT scan is ionizing radiation. It is low dose, a quick scan. And so it's weighing that risk of cancer based on the smoking history and exposure versus the CT scan itself. Now, you can have secondhand exposure, especially with a spouse, somebody in the household, something like that would increase your risk. But for most people, checking with your doctor, 50 to 80 years old, get that screening done. It absolutely could save your life. We want to diagnose this early when it's a small lesion rather than waiting and we find out it's metastatic disease.
All right, good information.
Thanks so much, and we'll see you in our next half hour as well.
Talking some carbon monoxide. Stay with us for that.
Thanks,
All right.
Doc.
Justin Logan has your forecast on the other side of the break.
You're watching Fox 56 News, our home, your news.